for joining us today at Charter Oak Health Center. It's my privilege to welcome you to this important gathering where we stand together as advocates, caregivers, community members, and champions for equitable access to health care. As you guys know, Charter Oak has been committed to serving the most vulnerable individuals and families across our community. People whose health and well-being depend on a strong, reliable Medicaid program. In these uncertain times, federal cuts to Medicaid threaten not just funding streams, but the very health, stability, and dignity of our patients. These are real people, children, seniors, individuals living with disabilities, and hardworking families who are counting on us to raise our voices and defend their care. We're honored today to be joined by leaders who have never shied away from tough conversations or tough decisions. Governor Ned Lamont has consistently demonstrated his commitment to protecting Connecticut's most vulnerable residents, whether it's through expanding access to health coverage, investing in our healthcare infrastructure, or advocating at the federal level to preserve essential services. Yeah, I was trying there. Governor Lamont has been a steadfast partner to those who need healthcare the most. His leadership in navigating the unprecedented challenges of the COVID-19 pandemic and his dedication to ensuring the healthcare system remains strong and responsive underscore his deep commitment to health equity and fiscal responsibility. It's with great respect and gratitude that I invite you to join me in welcoming the Governor of the great state of Connecticut, Governor Ned Lamont.
Well, it's great to be here at Charter Oak, and the folks you're taking care of every day are going to be really impacted by what this budget is all about. Just like to start off, on a personal note, thinking about the folks and the flooding in Texas. Hearts and prayers go out to the family. Matt Brockman's reaching out to Greg Abbott's chief of staff, and just thinking about what we could have done. I mean, budgets make a difference. And I think this budget that Republicans passed, the Trump budget, was reckless and cynical and mean-spirited. And I just think a little bit, hey, Senator, I just think a little bit about, the flooding. And you think maybe if NOAA was fully staffed, maybe just a little better warning. I don't know. Or FEMA. Seems like a really bad time to be saying we're going to cut back on FEMA dramatically and what it means for these folks. That said, as I, look at this budget, I'm here joined by our amazing federal delegation who stood up all night long trying to make sure that this budget at least reduced the amount of harm that it was doing for folks. And then Drea and our team here from the state talk about all the things, that we can do to try and anticipate what's going to happen to folks in this state. I'm sorry that a lot of the environmental, renewable energy, and energy efficiency, and things that maybe make flooding like we had in Naugatuck a little less likely is being pulled back. And these are the type of things, look, maybe the President Trump doesn't give a hoot about climate change, but, it's about affordability, and it's about safety, and it's about increasing capacity for a grid. We're going the wrong direction there. We're at a fairly qualified health center, and, our budget in the state of Connecticut, we've tried every day to make life a little more affordable with more opportunity for all. And when it comes to affordable, what's a bigger issue for folks than medical emergencies? And doing everything we can to expand insurance and expand coverage for all of our citizens here in the state. Make it a little more affordable, a little more accessible. We're making extraordinary progress there. And now this, the Trump budget does just the opposite. Starts pushing people off of Medicaid. Our grandparents and senior centers, and making them a lot more at risk. Home health care, a lot more at risk. And Andrea Barton-Reeves will start with some help here to talk about ways that we can try and mitigate the impact there. You know, that's affordability, and that gets to health care, that gets to energy. How about opportunity? I mean, we've made a big effort in our budget, because the budget is a reflection in your values in terms of a down payment on giving every single kid the very best opportunity in life. And that starts with education. And education doesn't start in kindergarten. It's pre-kindergarten and earlier, infant and toddlers. The Trump budget doesn't do anything there. In fact, they're talking about cutting tens of millions of dollars overnight. The portal is already shut down. You know, this is money that goes to after-school programs and high-dosage tutoring and summer learning programs and all the things that give young people the very best opportunity in life. And a little later on, we have something called AmeriCorps. We're trying to roll out a youth service corps, you know, Susan and I, and make that real for people across this state and help those young people develop the job skills they need, or we're able to help out a veteran or somebody at a senior center. You know, that's all been gutted in this budget. That's the mean-spirited part of the budget. The reckless part of the budget is just punching a Titanic-sized hole in the federal budget. And, you know, here in this state, we saw what, you know, borrowing was doing to our operating budget, and it was putting a big lodestone upon our future. And I think that's just what this Trump budget is doing in Washington, D.C. Big argument whether it's $3 trillion, $4 trillion, or $5 trillion in additional deficit over the next 10 years. That's $300, $400, $500 billion additional a year. And it's going the wrong way. And I just say, no Republican in Washington voted for this bill can ever use the words fiscal conservative with a straight face. And I want to hear where Republicans in this state stand on this bill. A lot of them are a little disappointed that we're only paying down $1 billion in pension debt this year. We're paying off our debts, and we're coming forward with an honestly balanced budget. They're not doing that in Washington, D.C., and I want to hear whether Republicans in this state, would they have supported that bill or not? Because it's impacting our kids, it's impacting our seniors, it's impacting, you know, a mom who's just getting by with the SNAP benefits and needs that Medicaid in order to take care of her kid. She's going to be a lot more at risk. That's why we're here today. We're here very united, here strong, and somebody who's dealing with it every day on the front lines for us is Andrea Barton-Reeves.
Good morning, and thank you, Governor. So when I was thinking about being here today, the thing that occurred to me is that just a few months ago, we were standing in the same room with the same group of people, sounding the knell, sounding the warning and the call that this was coming, that vulnerable people would be at risk, and that indeed they would be sacrificed so that others in the 1% could have more, that the deficit would grow, and that people would go without what they need, essential services, for the sake of making sure that people worked and earned what it is that they wanted. And unfortunately, we are back here just a mere few months later with this reality, what I would call a nightmare having come to pass. But what we know that is true about the state of Connecticut is that we are imminently prepared. And under the leadership of Governor Lamont, we have been preparing since the moment that we knew that perhaps this would be happening. So here are some of the things that we've been doing. We have made an $80 million investment in our federally qualified health centers, so that when we know that people may lose care because of the changes that we need to make to Medicaid and SNAP, we have shored up a critical partner, one of which we're standing in today, I'm sure by no mistake, so that we can know that our communities have places where they can go to continue to get qualified health care and quality health care. We have been doing our due diligence with other states who have implemented work requirements so that we wouldn't be starting from scratch from the moment that the statute was passed. So for months, we've already been investigating ways in which we can implement the work requirements, not even knowing what they were, but understanding what their impact might be, and then waiting for more guidance from the federal government, which is what we're doing right now. We've also been having continued conversations with our national trade associations and with our local trade associations, with our philanthropic partners, and with the nonprofit community at large, all of whom will have some sort of role or have some sort of impact in what we eventually do in order to meet what I am describing as the draconian implementation of this bill. So make no mistake about it. If you read the New York Times yesterday, you will note that that their version of OLR, if you want to call it our state version, but the Office of Management and Budget suggests that by 2035, 11 million people in the United States will have lost health care because of what has happened under this bill. It's truly unconscionable that we can think that there's a trade-off between living with dignity and care and a tax cut. There really is no equivalency there. There's no equivalency to living with dignity. There's no equivalency to living without health care. None of these things are true. So the narrative that we've been hearing about what needs to happen, that there are just hundreds of thousands of lazy people on Medicaid and SNAP who need to be brought to account by what is happening in this bill, which is now law, is just simply not true. Because according to the Kaiser Family Foundation, which is also known as KFF, 73% of the people in this state who are on Medicaid are working. Over 60% of the people in this state who are on SNAP are already working. This is not about laziness. This is not about sloth. This is not about any of the myths that are being perpetuated about poor and low-income people. These are about the people who have families and work 2 and 3 jobs. These are about the people in hospitals. These are about the people in nursing homes. These are about elders who need assistance in heating and living their lives and food. This is what we're talking about. Are what we call essential services. We know that they are life services. None of us could do without them, no matter where we are in the socioeconomic strata of this state or this nation. It's really indescribable what we're about to face. But what I do know is that here in Connecticut, we are really prepared to work with this. And so having done the work that we've done over time, I'm really confident that continuing to work with our partners, continuing to do the work that we've done, continuing to work, and I'm looking at my deputy commissioners, Isha Canada and Peter Hadler, along with their teams who have worked tirelessly from the moment that we knew that this was a possibility, so that we could hit the ground running when unfortunately the bill was passed, and we could know exactly what to do and to get more input and feedback from our partners. So I'm very proud of them. I'm proud of the Department of Social Services, and I'm particularly proud to be a citizen of the state of Connecticut. There is no better place that we could be living under the leadership of our congressional delegation and our governor to support the people who truly deserve our help, and that is everyone who lives here, regardless of their income, their zip code, their education. We all deserve to live with dignity, and that is what we intend to do. So thank you. I'm also your MC for today, so here's what I will do. I will next introduce Congressman Joe Courtney, who will talk to us about what's been happening on the ground in Washington, and then I'll come back to the podium and introduce the rest of our dignitaries who are here today.
Well, thank you, Commissioner. It was actually April 22nd that we were standing here. It was right after the House of Representatives had taken up the initial authorization for the reconciliation bill, which you correctly point out. I mean, the warning flags definitely went up that day. And, you know, what I would say is that there's been just a remarkable sort of coming together of groups who, generally speaking, are pretty adverse to sort of jumping into debates in Washington because they have, you know, feet in both camps and are nervous about that. But the American Hospital Association, the Catholic Hospital Association, the Children's Hospital Association, the American Medical Association, the American Academy of Family Physicians, the American Academy of Pediatricians, all of them who actually really understand what was going to happen by stripping coverage for people and the impact that that was going to have in terms of creating uncompensated care and cost shifting in the system, and what it's going to do in terms of patients as far as direct care was something that you know, every person who is even remotely close to the Congress should have listened to and heard in terms of the fact that this bill that was signed into law on Friday really is taking this country backwards in terms of trying to have a more rational, balanced healthcare financing system, as well as a system that was actually providing better, smarter care for patients. Last January, after the inauguration, President Trump said that he would love and cherish Medicare and Medicaid. In the history of broken promises, I think this one sort of surpassed "read my lips, no new taxes" in terms of just just how outrageously unspeakable the promise that I think a lot of people in this country believed, who are on Medicaid, and people who voted for the president who are on Medicaid and now are about to again get a bitter taste in terms of what damage is being done. And I want to be clear, because this is something that didn't get that much coverage, but the size and magnitude of this debt, which the governor pointed out, triggers another law in the federal government, the PAYGO law, which puts into effect automatic rescissions across the board. And the first target of those rescissions is Medicare. And the CBO office has already calculated and reported well before this vote, by the way, that would trigger a 4% across-the-board cut for all medical providers who have Medicare reimbursement or patients, including Charter Oak and federally qualified health centers. But again, a 4% across-the-board cut, which, unfortunately, the state of Connecticut really can't do much about that in terms of just, how do you make up the hole that's there. But if you read the PAYGO law, it doesn't stop there in terms of Medicare, because if the budget deficit is big enough, there's a 14-page list which John Larson's Committee on Ways and Means has in terms of what's next on the chopping block. Veterans programs, housing programs, healthcare fraud and abuse programs are also subject to these PAYGO cuts that are there. And again, over time, we are going to see really the second wave, the second ripple effect in terms of what the damage of this, just a massive amount of debt financing, which is included in this bill. The total in terms of Medicare is $535 billion. That, again, is getting hacked out of the system on top of the $1 trillion that's coming out of the Medicaid program. So, at this point, again, we are very blessed. I feel very lucky to come back home and have leadership like we have in Hartford that's here, both in the legislature, in the governor's office, and DSS that is there. But, this is a time where there is going to be a race out there for the truth in terms of, what happened last week in terms of this bill, because there are going to be forces and money and groups that are going to be trying to confuse and mislead people about what actually this bill is all about. And it is so important that all of the folks that are up here and in the media and across the state understand you cannot over-communicate at a time like this in terms of making sure that people understand crystal clear, what choice was just made by people who, again, were led by a president who just willfully and flagrantly violated the promise that he made to the American people. It's a lot of people are like saying, "Oh, you must be, glad to catch up on some sleep." Actually, the work really now begins, and that's really what we're here today to make sure that we understand that and execute on that. Thank you.
So I actually have the order incorrect. So I'm actually going to now turn the program over to Dr. Vicente Diaz, who is the Charter Oak Chief Medical Officer, if you wouldn't mind.
Actually, the name is Luis Diaz, not Vicente. Thank you, everybody, for being here today. Welcome to Charter Oak. By now, we all know that the new bill that was just approved by Congress and signed into law mandates changes to Medicaid and health insurance that will result in an increase of the number of uninsured people. We need to get ready, and just like it was mentioned before, Connecticut is probably one of the best places to be at. Over 900,000 Connecticut residents depend on Medicaid for their health care, including a third of our children. So about 300,000 of our children depend on Medicaid, Husky. It is my strong belief that everybody should receive adequate health care and that this is a basic right. We are in a crossroad. We can say, like we say in Puerto Rico, ay bendito, or we could say, oh well. On the other hand, we can say, what is it that we're going to do as a community to make sure that all Connecticut residents can have access that is adequate to health care, and that all Connecticut citizens are treated with decency and respect. Governor Lamont, Congress, Senators, we are ready. We are looking for your guidance and your leadership to achieve these goals. I personally volunteer Charter Oak to join you, and this institution is ready for you. Thank you.
Now I'd like to bring Senator Richard Blumenthal to the microphone.
Thank you. Thank you. Well, I am proud to be home with leadership that really recognizes the public responsibilities that we have, not only to the poor and vulnerable, to all citizens. And thank you to Governor Lamont, to our legislature for being so farsighted and making sure that we have the resources to compensate for a lot of the losses that we're going to see. You know, this last 2 weeks has probably been, for me, the most painful of any time that I've been in public life. I have been so deeply ashamed of our political process for failing to recognize our public responsibility, not only to the poor and vulnerable, but to working families that will be devastated by this bill. And I saw our colleagues on the White House lawn behind the president as he signed that bill. I heard them applaud on the floor of the Senate after we'd been in session for a day and a half continually. The exultant celebration of this massive rollback in public responsibility is absolutely disgraceful. But let me just say to my Republican colleagues, this victory for you is Pyrrhic. It's a Pyrrhic victory because the American people are going to hold accountable the elected officials who voted again and again and again, day and night, on the floor of the United States Senate to keep in place a massive rollback in public responsibility. 3/4 of what President Obama did with the Affordable Care Act has been eviscerated. Most of what President Biden did in the Inflation Reduction Act for the environment has been decimated. The numbers begin to tell the story, but you're going to see it in the mom who discovers a lump in her breast, the kid who breaks his arm on the playground, the senior who's in a nursing home. They are all at risk, and it will fall to Charter Oak and other federally supported health clinics like this one to fill that gap, not just for the people who come here now, but for working families who are going to lose their premium subsidies for health care. And make no mistake, the costs for everyone are going to rise. The cost of food will rise, the cost of energy and housing. We're going to lose the subsidies for clean energy. We're going to lose nutrition assistance. We're going to see borrowing costs rise because of that debt. The ripple effect of this massive rollback in public responsibility is going to affect working families, not just the poor and vulnerable, all of us, in the rising prices of food, energy, housing, health care across the board, and eventually, potentially, our economy. The focus on the debt, I think, is really important. $5 trillion over this next decade, in addition to the $36 billion we have in federal debt right now, is going to inflict pain across the board in job losses because of the inhibitions to borrowing that companies need to open new plants or do more manufacturing, which provide more jobs. And it's all for what purpose? To provide massive tax cuts to the ultra wealthy. This bill enacts the biggest transfer of wealth from poor to rich in the history of America. The biggest transfer of wealth from poor to rich in the history of the greatest country in the history of the world. And there are various estimates of it, but the one that struck me is from the Penn-Wharton budget model, which says the top 1% are going to save $30,000 annually. The bottom 40% will be poorer. This bill benefits disproportionately and perhaps solely the most wealthy people in this country. So let me just say, this fight is far from over. I want to say we have just begun to fight. We need to mobilize as Connecticut and around the country we've begun to do in the streets, in neighborhoods, through the mass demonstrations that we've seen again and again in Connecticut and across the country. Many of us have traveled to other states where Republicans are declining to hold town halls. Don't expect them to be having a lot of town halls in the future as the impact of this bill becomes clearer. We have a budget, 2026 budget. There's going to be a fight over that budget. And we have the opportunity to reverse some of these most damaging provisions before they actually take effect, because a lot of them come into effect in 2027 or 2028. There is still the opportunity to save America. I know it sounds like an exaggeration, but it's true. Saving America is what we need to do in the months and elections ahead. And I'll just close on that note. Elections have consequences. We will have elections. The way to stop the most damaging provisions of this bill is to change the Congress, to elect new members of the House and Senate, Democrats who will fight to preserve our democracy and our health care and other social net systems. Social safety net systems are essential to the future of our entire economy and our society. So we have to mobilize to change the leadership in the House and in the Senate. It is absolutely doable in the House. It's more uphill in the Senate. But we have our work cut out for us. This fight is far from over. And we need to be fighting as never before with the energy and determination that I think America will feel after it begins to sense what really happened, the real consequences of this measure. Thank you.
Let's see. Now, Congressman Larson.
Thank you, Commissioner.
Thank you. Okay. Let's check and make sure you're still
Well,
there.
it's that old saying, it's great to follow your colleagues. And I want to thank Joe and Dick for their remarks. I also want to applaud the Governor and the General Assembly for being here. Both Joe and Dick and I all served in the Connecticut General Assembly. And in terms of shifting and looking at the broader picture here, how is it that Trump can say and Republicans can say, we're not going to touch Medicare or Medicaid. We're going to leave that up to the states. What we're going to do is take the responsibility that is federal and shift that responsibility to the states. And that allows them, I don't know how they look themselves in the mirror, as Joel was pointing out, when they look at the damage that they've done. Look, everybody likes a tax cut, right? Everybody wants the tax cut, but even those who benefited from taxes, and there are taxes in here that are beneficial, where are they deriving the money from for those tax cuts? By kicking people off the #1 nutritional program for the country in SNAP? We're talking about the disabled. We're talking about veterans. We're talking about mothers, children. The very nutrition that they need will be cut. Now, Trump's also very clever, and something that Joe said, I think, is probably, and when we talk about the fight is going to have to take place in terms of what is the truth in these competing messages that are out there. What is the truth? And if some of these acts that they've put forward don't take place till after the midterm election, who explains that to the American people? And so that dinner table discussion or issues discussions that we always talk about as being what really impacts people and what really motivates them, for some, they're going to continue to receive payments and say, what are the Democrats talking about here? I'm still getting my Social Security check. I'm still being taken care of. And they're banking on the fact that the Connecticut General Assembly, the governor and lieutenant governor, are not going to let this happen. He's a very clever person. But as both Joe and Dick noted, we're seeing the middle class disassembled right before our very eyes. And if you don't think that they are trying to disassemble the media, check out what they did with NPR. Check out what they did with PBS. Because they didn't want a voice or voices that are critical of the king. How fitting that 250 years later, we're still dealing with those who want to reconcile the king. Pre-revolution, that was the King of England. Today, it's King Trump and what he desires. I think David Brooks described it best. He said that he's a narcissistic nihilist. Now, everybody at Augie and Ray's understands what that is. But the point is, the grasping of as much power as he's been able to do, and as Dick and Joe have pointed out, to see our colleagues surrender in co-equal branches of government their responsibility to let 17 million fellow Americans lose their health insurance coverage, or watch, as people will in the state of Connecticut, that health insurance cost rise, that's an abomination. But they're saying, no, we're not touching any of that. What we're doing is stopping the fraud, abuse, and waste that occurs. And for a lot of people who want to believe that, they're going to nod their heads. What's the truth? Who will tell the truth? We will, but you're going to decide. The media will fact check and follow through and help the public understand exactly what's going on here. The middle class is being disassembled before our eyes. Social Security, the nation's #1 anti-poverty program for the elderly and for children, is being privatized from within as we speak. Rise up, America. Rise up and speak out, because it's the people's voices. As Washington remarked about Thomas Paine's Common Sense, it was that document, reading what the truth was, that convinced those, the Tories who were in favor of reconciling with the king, that no, independence, self-governance was the way to go. And it will be the people again, through our process, that convince their colleagues, or they will replace them, that we cannot take away the nation's #1 anti-poverty program for the elderly, for children, for the nutritional programs that keep food in the mouths of people who need it the most. For God's sake, what is government of and by the people if it is not helping the very people who need it the most?
So I appreciate your patience. We have a few more speakers. I will probably ask speakers to be cognizant of the fact that it's quite warm in this room, so we will ask you to keep your remarks brief. I do have a brief statement from Rosa DeLauro, and then after that I will ask our Lieutenant Governor, Susan Weisswitz, to join us. So Congresswoman DeLauro says this: President Trump promised to lower the cost of living from day one. Instead, he and Republicans in Congress cut taxes for the ultra-wealthy while sticking working and middle-class families with the bill. President Trump's bill hands $4.5 trillion in tax cuts to billionaires and the biggest corporations, while getting the very programs that help everyday Americans to survive. This bill slashes Medicaid and the Affordable Care Act coverage, ripping critical and affordable care from nearly 17 million people, including 186,580 people in Connecticut who rely on Husky or Access Health. Republicans have not expanded the child tax credit. It's worse than the current law, and it is not the monthly child tax credit that helps 61 million children in 2021. I often say, show me your budget, and I will show you your values. President Trump and the Congressional Republicans' budget reveals a simple truth. They are not fighting for everyday Americans, and they are not laser focused on the cost of living. They are focused on the wealthy and the powerful once again. I will not stop fighting to protect vital services, to bring down the cost of living, to ensure people have quality, affordable health care, and to bring back the expanded monthly tax credit, which delivers the largest tax cut in America in generations. America deserves a budget and a Congress that works for them. And again, those are the words of Congresswoman Rosa DeLauro. And now, our Lieutenant Governor.
Thank you, Commissioner. Good morning, everybody. Budgets are value statements, and this budget bill gives billionaires and big corporations tax cuts that are paid for by working class families, poor people, kids, and sick people. It's just unconscionable. And what is particularly devastating is what will happen to health care for 17 million Americans and more than 1 million people right here in Connecticut who are on Medicaid. Basically, when it comes to work requirements, this bill is very cruel and insulting because it requires Medicaid recipients to report every 6 months. And that gives the opportunity to punish by paperwork. because it's designed to trip people up, get stuck in red tape, and ultimately people's coverages could be stripped. And it also just doesn't recognize the fact that many people in Connecticut are working really hard. They're on Medicaid. They just can't afford insurance. It is so cruel. Also, you know, let's think about the 355,000 families that are on SNAP assistance. How many kids and families will be hungry as a result? It's just terribly unconscionable. We've talked about fiscal responsibility. Well, $5 trillion that will be added to our national debt, and $350 billion is going to go to stepped up ICE enforcement. We are here in a state that is already terrified because ICE is visiting communities across our state. And to spend $350 billion on stepped up enforcement is more than many countries spend on their military. So I think it's very important to point out that that is a terrible aspect of this budget bill as well. So I think it's very clear we are all united, standing together, our state legislators, our federal delegation, and our constitutional officers, saying that we're here to take care of the people of Connecticut. We believe in providing food and health care for kids, for families, for sick people, for our elderly. We are here to serve the needy, and we are not going to stop criticizing this budget, but we're going to step up to take care of the people of Connecticut. So thank you all so much for coming.
Next, I'd like to invite the State Comptroller, Sean Scanlon, to speak about the bill.
So there's three things that I hope the people of Connecticut know about this. The first is that this is a bad bill for the working and middle class here in the state of Connecticut. And if you don't believe us about that, do your own research. Find out for yourself what this is going to mean for you and your loved ones, the business that you work at, the small business that your family has run for generations, and this health insurance was able to be accessed by you because of this and what this means for you. But the second thing is that right now there's a lot of people in the state of Connecticut who are afraid. They watched that bill signing on Friday and they thought, what does this mean for me? I'm worried about this. Joe mentioned going around the state, being here. We've been traveling around the state for months talking about this with people, and people have genuinely been expressing their fears and concerns. And so our message to the people of Connecticut is, we got your back. We're not going to let you fall through the cracks. Under this governor, in this legislature, we're going to step up to make sure that the people of Connecticut impacted by this bill are going to be protected, and we should be damn proud of that. But the third thing is the hard part, which is, where do we go from here, right? We have to educate people about what this bill means. We have to obviously make sure we step up to the plate and make sure people are protected. But we can't just get back to baseline, because the baseline wasn't working for the people who come to this community health center, or the people who live in this neighborhood, or the surrounding towns in the state. We have to do more. And when we do more, and we put out the plans of how we're going to do more, we can win back the trust of the American people who are being misled into thinking that this mirage of a bill is good for them. And we will ultimately be doing what we have always done as a party, which is to stand up for the working class and the middle class and fight for the people who need the help of the programs that President Trump and the Republicans in Congress are doing their very best each and every day to destroy for political purposes. So proud to be here today. We have a lot of work left to do. Do your homework, and we're there for you. Thank you.
So there are two state legislators among many who sit on our Human Services Committee, who have been right in the center of all of this. So I'm going to first ask Senator Lesser to come to the podium, and then after that I will ask State Representative Julian Gilchrist to close out our comments today.
Thank you so much, Commissioner. Thank you for your moral and consistent leadership. I also just want to acknowledge some of our Human Services Committee's members who are here today: Representative D'Amico, Representative Johnson, Representative Shake, Representative Fortier, and Representative Kitt. It is beyond clear to me that we are immensely lucky to live in a state where, under the leadership of Governor Lamont, we have been fighting to protect this program. Very grateful as well to all 7 members of Congress representing the state, including Congressman Courtney, Congressman Larson, and Senator Blumenthal. But let's be crystal clear. This law is a human catastrophe for the people of Connecticut, the folks that we work with on the Human Services Committee. And as Congressman Larson mentioned, one of the troubles is that folks have been lied to. They have been flim-flam. They have been bamboozled. When I talk to my constituents, they still believe, because they have been told so, that there are no cuts to Medicaid, that Medicaid hasn't been cut because the president and Republicans in Congress promised not to cut Medicaid. And yet on Friday, a report from the Kaiser Family Foundation projected that here in Connecticut, we are looking at a $13 billion cut to the Medicaid program. And they've been told, well, first they said there were not going to be cuts to Medicaid, but then if there are cuts, don't worry, it's only to undocumented immigrants, or it's only to undocumented immigrants and people who don't want to work or who are staying at home. But those cuts don't go to any particular program. They go to the state's Medicaid program overall. And when you look at the biggest cost in the Medicaid program for Connecticut, it's not undocumented folks. There are no folks on the federal Medicaid program. It doesn't go to childless adults. The single biggest cost in the Medicaid program are seniors, American citizens living in nursing homes. That's where the cut is to. That's where that $13 billion is coming out of. And that $13 billion doesn't include the cost shift from the federal government to the states for running the SNAP program. Food stamps are now a state responsibility because of this flim-flam game, which is to make it look like we're giving a tax cut by shifting costs onto state taxpayers. So when we have to look at revenue, when we have to look at tough decisions that we didn't want to have to look at, those are going to be the Donald Trump and Republicans in Congress tax increases. Right? When we have to look at windfall profits that some folks in the state are going to be getting because of this terrible bill, that is Donald Trump's decision, not anyone else's. Look, I think a Connecticut resident, P.T. Barnum, is accused of saying you can fool some of the people all of the time and you can fool all of the people some of the time, but you can't fool all the people all of the time. And when folks look at what this bill does, they see that that email they got from Social Security last week that said that they don't have to pay taxes on Social Security anymore isn't true. There is nothing in the bill about Social Security at all. When they see that they have been lied to day in and day out, eventually they're going to realize what's going on, and they are going to be mad as hell. And those congressmen who voted for this are going to be ex-congressmen. But we have to pick up the pieces. We have to figure out how we can support Connecticut DSS, make sure that hundreds of thousands of people in this state don't lose their food, don't lose their health care, our nursing homes don't shut down, our hospitals, our health centers don't shut down. We've started that work, but we have a lot more work to do. I'm here to do part of it. I'm happy to be part of it. I couldn't do it without my co-chair, Representative Gilchrist.
Thank you, Senator. At its core, this is about people losing access to health care and food. And it's not surprising that Donald Trump, a liar and a cheat, would assume the worst of people and claim as his motivation waste, fraud, and abuse. But the Republicans in Congress, they heard from their constituents. They read the same reports that we've heard about today. They know that these cuts to Medicaid and SNAP are going to impact that woman who works 2 and 3 jobs and can't afford a month's worth of groceries or health care for her children. They know that this is going to impact families who are just trying to do the best by their aging parents in a nursing home. They know this is going to impact the parent who has a child with intellectual and developmental disabilities and is trying to get them the services they need. They know this is going to impact hospitals who will be decimated by these cuts, and Planned Parenthoods, who are our largest family planning provider in the state and across this country. And they know that the work requirement policies are unnecessary and costly. They know and they don't care. This isn't about getting people illegally on programs off, as they've been telling you, because that's not what the data shows. That's the lie they're feeding you so they can take your tax dollars and use them to make the rich more money, instead of investing those dollars in programs for you. So now it falls to the state, and as you've heard, we have quite a team here in the state of Connecticut. Yes, we'll have to address the administrative costs that come with these cuts and work requirements to Medicaid and SNAP, but we're also being presented with an opportunity to step up and make investments in our values. And so I thank each of the people who are here today, and I look forward to working with you to make that a reality. Thank you.
So thank you very much. We will open the floor for on-topic questions.
I have a question. So we've heard a lot about how Connecticut can and will do certain things to mitigate the effects of this bill. Could you guys talk kind of